Well, I'm absolutely delighted now to be joined by Dr. Felicia Knaul from the Harvard Global Equity Initiative. Dr. Knaul, thank you very much indeed for joining us today.
Thank you for having me here. I'm very pleased to be here.
Now, you've been talking this week about a diagonal approach to maternal and child health. What do you mean by that?
There's been a false, relatively useless debate, I would say, between whether or not it's more important to do vertical programs, disease-specific programs, or horizontal programs, which are more the systemic kind of programs in health and in strengthening health systems. And the diagonal approach, originally put forward by Jaime Sepulveda and then Julio Frank, suggests that you have to do a combination of both, that it's not an either-or, and that you can actually use disease-specific programming to drive through improvements in health systems, and vice versa. And that's really the nugget behind the diagonal approach. It's a win-win situation, but it's also an idea that the whole is more than the sum of the parts. And so together you can actually get a better outcome by thinking of both than of either one.
I mean, forgive me, Dr. Knaul, but it seems common sense, doesn't it?
Many of us who have worked on a particular disease have worked only on that disease and haven't deviated from working on that disease. And there's been tremendous criticism in the literature about why we don't want a disease-specific approach. Why that certain nugget of interest in something that seems so simple came out, you know, we can only say that we're lucky that it happened, but that it's also taught us something about our work on cancer. The Global Task Force on Expanding Access to Cancer Care and Control, what I think has made this a little bit novel is that we've forced a diagonal conversation between leaders in global health and public health and leaders from the cancer community who before had not talked together. And so, of course, this cross-fertilization of ideas comes out with some hybrids that are quite interesting. The diagonal approach hadn't been applied to cancer before we started thinking about it this way either. And we were discussing this extension to maternal and child health, sexual and reproductive health, and HIV/AIDS and anti-poverty programs. And when we had to sit and think, well, how can we quickly get information that's useful to women about breast cancer to these women in a massive way? We have no funding or way of repeating or, again, making that kind of a network and outreach. And it makes actually tremendous sense to be focusing on these programs.
But will such an approach work when it comes to dealing with the inequity, which is that so many avoidable deaths are in the lower and middle income countries?
My answer is yes. First is that we know with something like breast cancer that if you can detect earlier, our treatments are much more effective. And this is particularly clear, obviously, in countries like Mexico, where there is access to treatment. And I do believe that even with a minimal amount of training and knowledge, a promoter, midwife, can help train a woman to do a lot better than what we see. It's not a substitute for some of the higher end technology like mammography, but it is certainly a place to start to improve and to reduce the number of avoidable, preventable deaths that we're seeing.
A lot of the issues you've talked about are socioeconomic actually within a country, so what can the donor countries do to help?
First of all, the bilaterals have to become more involved. They've rejected the non-communicable disease argument, the chronic disease argument, and all of what we're doing on NCDs, which we've been renaming new challenge diseases rather than non-communicable diseases. This has been really falling into a false debate, a false either-or debate, rather than seeing that these are often intimately linked, a communicable disease and the outcome of some of the diseases, which ends up being a non-communicable disease, or the fact that a cancer like Kaposi sarcoma happens to people with AIDS. This has been basically forgotten by the bilateral donors, and in fact even rejected in the face of trying to achieve the MDGs and other development goals.
Dr. Knaul, your own story is very powerful, and so are the stories you've been telling this week. Now, when you look around the world and you look at the inequalities that you see, I've got one more question for you. Do you think we're making progress?
Yeah, I think we are making progress. We have some very innovative new programs like the Seguro Popular in Mexico that takes a diagonal approach, and then in addition to ensuring population is also ensuring specific diseases like children's cancers, like breast cancer, like cervical cancer, like testicular cancer. These are very innovative solutions. We have some phenomenal programs all over the world using telemedicine to be able to link children with cancer, adults with cancer, to subspecialty experts in high-income countries who can be, across the ocean away and still are able to give the right kind of direction and care. And that's a world where we're connected through telemedicine, through technologies. So I think we are making progress.
Dr. Knaul, thank you very much indeed for joining us today.